Hi, I'm Val Wolf from the Hamilton Clinic of OCOW, the Occupational Health Clinics for Ontario Workers, and I'm here with my colleagues Eduardo Huesca and Michelle Tu, and one of our physicians, Dr. Donald Cole, to present some information about COVID and in the context of worker supports and information. And it's meant to be, maybe you can flip to the agenda. This is who OCOW is, which maybe I'm not following my own agenda, but just for those of you who don't know us, we are an occupational health clinic funded through the prevention system, and our mission is to protect workers and their communities from occupational disease, injuries, and illnesses, and to support their capacity to address hazards and promote the social, mental, and physical well-being of workers and their families. And we have 7 clinics across the province, as well as a provincial office in Toronto. So the agenda on the next slide, just introduced for this afternoon, is that we have partners with us today from the Ministry of Labour, Training and Skills Development. And we're going to frame their presentation on COVID-19 and the role of workplace parties, and also what they've learned in the couple of months that they've been running an initiative on farms with respect to temporary foreign agricultural workers. And we're going to do a bit of an intro about our migrant farm worker program. Also, Dr. Donald Cole has written an occupational medicine perspectives on the heightened COVID-19 risks to temporary foreign agricultural workers, and he's going to mention a few things from that document, which is on our website. And then we will hear from the ministry, 3 speakers, Ron Landry, Vince Latona, and Denise Madsen. And then Eduardo will take us back through sort of what does this mean from a worker perspective? What can we learn from it? What more can we do? And then Michelle will share information about healthcare, because there's an intersection between sort of labor regulations and issues and health regulations and issues when it comes to a pandemic. And also WSIB and income protection, because that is also a very real concern for workers and for employers, and it is part of the equation. And then we hope to have time for discussion and feedback at the end with all of the presenters still available. So I'm going to turn it over now to Eduardo. Thanks. And I am going to turn off my camera and would ask everyone else to do so as well, just to maximize our audio quality because we're using less bandwidth. Thanks.
Great. Thank you, Valerie. So we just wanted to start with a worker recognition and thank you message in case there are any workers that have joined us today, and for the rest of us to take a moment to contextualize our work and today's presentation. So thank you for the work you do. We want to ensure that you have a safe season and are reunited with family and loved ones in good health. We want to wish a safe recovery to the farm workers who are currently ill with COVID-19 and thank the healthcare providers who are currently looking after them. We give our condolences to the families and loved ones of the farm workers who have passed away from the virus. We know, I think recent reports have identified 3 people who have passed away. And thank you for everyone here for joining us. And really the motivation is to work together to stop future COVID-19 infections among farm workers. So we wanted to give just a really brief review of OCOW's experience working with migrant workers or temporary foreign agricultural workers. So we also, just really quickly, there's been some talk about how there's been a shift in how we speak about these communities or identify them. Some folks are still using migrants. There's also a shift from some folks to temporary foreign agricultural workers. We have heard that some people identify migrant as an offensive term, so we really want to clarify that. We hadn't really heard that, but this is something that maybe we need to at some point acknowledge and maybe probably take cue from worker communities themselves. But just to point it out there, we mean no offense. So our work with these communities started in 2006 through running mobile occupational health clinics in community settings where our occupational health physicians and nurses like Dr. Donald Cole and Michelle Tu, who will be speaking, would see workers presenting with or providing consultation on health issues workers believed were related to their work. And we ran those clinics in main agriculture regions and really got to learn about the occupational health issues that these workers are experiencing. From there, we developed occupational health and safety prevention-based workshops to speak to workers about the health issues and some of other workplace hazards in agriculture. And we presented these workshops on farms as well as in the community setting. So over 1,500 workers have participated in our workshop across Ontario. We've also done a lot of work identifying resources, educational and prevention-based resources, and circulating these resources quite extensively through the province and to worker communities through events such as health fairs in various community levels as well. Our work has taken us to do a lot of collaborative work with other organizations, agencies, community health centers, researchers, and other health professionals as well. So we've gotten to be part of also great work led by a lot of you that might be tuned in as well. So we just wanted to give a really quick background a bit about how this webinar came to be. So we should have probably have asked her to speak directly, but Christy Eve, the Ministry of Labor Vulnerable Worker Specialist, was an important catalyst to this. So we have worked with Christy for quite some time, and she has also worked with the farmer employer community, or works with the farmer employer community through way of the ministry's Technical Advisory Committee for Agriculture. So Christy had connected me with Stéphane Laraz from the OFVGA, who has also been working very hard to get resources and information to his members as well. So the idea really, in light of the current outbreak and infections, as well as deaths, was to pull together key information the ministry has gathered from investigations, complaints, and inspections to understand safety breakdowns and what has gone wrong in these situations, and direct this information as quickly as possible back to the industry itself, to employers and to workers, to increase our safety attention to key areas and address gaps. So at noon, some of you may have tuned in, Stéphane and the OFVGA ran a webinar with employers, and here ministry speakers will repeat this information, but in the context of our understanding of worker experience and needs, to spur discussion with this audience, but also it will be recorded and sent out through worker channels along with other information and resources we're putting together. But before we get to that, I do want to introduce my colleague, Dr. Donald Cole, who will provide some important background and context. Donald.
Thank you very much, Eduardo. It's a real pleasure to be here with everyone today. So a bit about COVID-19 and the pandemic we're in. COVID-19 is a highly contagious infectious disease caused by a coronavirus, SARS-CoV-2. Over 101,000 people in Canada have had the disease. About a third of those cases in Ontario. And while in certain parts of Ontario, cases in the general population are going down, the number of cases among farm workers are going up, as we probably all know. Next slide, please. So how has this virus spread? A big part of it, and people have probably seen all the information signs up, is from inhaling droplets and even smaller particles in the air after they come from an infected person who coughs, sneezes, talks, sings, breathes, does lots of regular things for people. Important thing is that smaller particles, sometimes called aerosols, can be in the air for hours. And particles or droplets which contain the virus can remain on kitchen counters, tools, for several hours up to days. Touching any one of these surfaces or breathing and then touching your mouth, nose, or eyes can cause you to be infected. And in addition, it's worth noting that touching surfaces in washrooms and being in washrooms, because the virus is excreted in the feces, for example, in hospitals, the air in toilets and washrooms actually is higher in COVID or SARS COVID-2 than other parts of a hospital ward or the like. Next, please. So why do temporary foreign agricultural workers have a greater risk of exposure to this virus? First is that agricultural tasks, such as these workers weeding in a field, as well as the tools they use, those same hoes can be shared by a number of workers who may or may not be wearing gloves. All those can kind of put workers in proximity. Some equipment, like planting equipment, some of the harvesting equipment, is actually designed with workers quite close together. Unless, like some of the innovations that have been happening on farms, unless there are plexiglass protections between workers that are on, let's say, a planter, then the virus can be transmitted and the workers are in quite close proximity. The other thing is that most agricultural work is outside in the fields, although clearly some is also in greenhouses, etc. But that means that soap and water for washing is not as readily available. Workers who are from Mexico, the Caribbean, and the like also share housing. It may be a house, but it could be a bunkhouse. Often, historically, they've been somewhat cramped. And a number of workers share washroom and kitchen facilities. And this is one of the areas of debate, how many workers can be in a particular kind of housing safely. So we can talk a bit more about that if people have questions. Group transportation, such as minibuses to and from the agricultural workplace, is also an area where people tend to be closer together, and certainly some farms have developed distancing protocols the same way we have in public transportation and the like, but that's a routine part of their work. And that's also true for local workers hired through contract agencies that can also be shipped to a farm. Temporary foreign agricultural workers also go into town for supplies and services, and they therefore mix with people in the community, as well as fellow workers who may be hired locally. So there's lots of interaction on a farm and in a greenhouse that can place workers in close proximity unless protocols are followed. Next, please. Because this virus has spread from person to person or person to the environment to people, those in enclosed areas are at higher risk. And as we know quite well now, that people can be infected and not actually feel sick. That's either because it's before they're going to get sick, pre-symptomatic, or they just never feel sick. They're asymptomatic. So unless there's testing, like in the picture you see here in the Windsor-Essex area, agricultural workers who are infected but don't feel sick won't necessarily be detected and alerted to that fact. And it's only recently that agricultural workers have moved up the priority list to be among those to be tested for the virus proactively, such as has been happening in long-term care homes and the like. The other thing is that workers who are sick, they may fear losing wages. We've known that for some time, and potentially reprisal and being deported once they're sick, being sent home. So there's certainly not historically been a great incentive for workers to report their illnesses. Further, some supervisors may take mild sickness reports insufficiently seriously. For example, saying it's a cold or allergies, or maybe they're affected by the heat, the like. And this is a concern we've heard from some workers, that their reports of sickness haven't been taken seriously. Next, please. So what are the signs and symptoms of COVID-19? It varies a bit by population and age, but in the working age population, this is a fair representation from the WHO. The most common ones on the left, fever, dry cough, tiredness, and then a bunch in the middle that can also occur, some of which are quite characteristic of COVID-19, like loss of taste or smell. And then on the right, you can see the really serious symptoms, which can have occurred to some of the workers who have ended up in intensive care units and the like. Next, please. So how many cases are there? It's hard to know exactly, but it appears to be about 500 to 700 temporary foreign agricultural workers who have been diagnosed with COVID-19, and at least 9 outbreaks on probably, and when you add together the individual workers that have tested positive, it's about 15 of the 1,300 agricultural operations in Ontario. You can see the main areas affected there. What it does mean is that lots of places, lots of agricultural operations have not had COVID cases, which is the good news, and either due to not having infected workers on site or really good practices. So part of the purpose of this webinar is to talk about some of those and what can be done to keep many of the workers, agricultural workers, healthy. Next, please. I think this is over to you, Eduardo.
Sorry, my fingers aren't doing so well on the control. No, so this is a segue over to me. So it's Val again. Just, I think, framing, as many people know, in fact, probably everyone in the call knows, that there's an abundance of guidance from all levels of government, public health, other ministries besides the Ministry of Labor, sector associations, the federal government, and elsewhere. We actually just put some guidance from the CDC on our website this morning. So there's an abundance of information provided to employers, but we are recognizing that outbreaks are happening, and it is vital to figure out what went wrong, where there were outbreaks, so that we can learn from that in order to enhance future prevention. So that's one of the reasons for this presentation, and particularly for the involvement of the Ministry of Labour Training and Skills Development, who will share some of their recent findings from their enforcement initiative and from investigation of illness.